So from funding to looking at productivity, and of course, we always talk about investment opportunities in the area of the workers' welfare. We've seen the Nigerian government attempt to spread or accelerate the growth of the health insurance. I wonder how you would grade that. But let's find out who can tell us how she sees that. Today, Dr. Tinuola Akimbolagbe, the Managing Director and Chief Executive Officer of the Private Sector Health Alliance of Nigeria. Thank you so much, Dr. Tinu, for your time. I hope I can call you that. Yes, I'm a friend, Dr. Tinu, so it comes so easy to me.
Thank you for having me.
Good to have you. So we've heard and seen a lot of attempts. Lagos State government has its own attempt at health insurance. Of course, the federal government does have NHIS. Some hospitals do accept it, others don't. From your perspective, how have we done when it comes to pushing the insurance to reduce out-of-pocket payment for, well, in this case, we look at the employees, the welfare of employees?
So the initiative to actually establish health insurance in Nigeria is good and has taken quite a number of years in the making. The law was initially passed in 1999. So we've been at it for close to 20 years. Could we have done better? Yes, definitely. Right now, the coverage is at less than 10% of the Nigerian population. And of that 10%, I think the bulk of them are within the civil service and the organized business sector, the organized private sector. A large proportion of Nigeria, which is the informal sector, are not covered. So there are lots of arguments about the specific rate of coverage, but everybody agrees that less than 10% of the Nigerian population is covered by health insurance.
Have you followed the story of Lagos State? Because I believe they do have Ilera Eco,
yes.
You know, which they try to incorporate the informal sector. How is the response to that?
Well, Lagos State, as usual, is a pace setter in health in Nigeria, and the initiative of Ilera Eco is a laudable one, and they're the first ones to even take it up to try and bring the informal sector on board. It's had a mixed reception. It's still at the early stages, so it's a bit difficult to assess that. There are a few other states, Kwara State, Delta State, that have made significant strides in health insurance coverage for the informal sector, community health insurance and all that. But there are huge variations across the nation. And with the recent incorporation of the NHIA law, which was done in late 2022, I think that's the last thing that the Buhari administration completed before they left. We do expect to see that implemented shortly. And with that, we should be able to achieve good coverage across Nigerians.
Are there opportunities in there for the private sector? We do know once the private sector gets involved, the private sector is there for profits. The government can do it for social reasons, you know. So are there opportunities for private sector investors?
There are huge opportunities for private sector. So my organization, the Private Sector Health Alliance of Nigeria, PSHAN, is at the forefront of elevating the business voice to policymakers and fostering collaboration between the public and the private sector in the area of health. In many countries, the healthcare sector is a large contributor to the GDP. In Nigeria, we really don't have that. We have medical tourism outbound, where we should have medical tourism inbound. And health should be a sector that actually contributes to the GDP.
But is it true?
People.
Sorry, let me just interrupt your thoughts there. I hope you will be able to pick it up. Is it true that it's beginning to reverse? Because it's been noticed, for instance, that costs, it's less pricey in Nigeria, labor cost and all of that. Is it true that we're beginning to see a reverse, even though, you know, it's the early days yet?
Yes, that's true. We're starting to see some reverse tourism, especially with Nigerians who have studied in the diaspora and come to set up their own establishments here. So people find that it is easier, more affordable to come and have some of their procedures done here. but there's still a lot of room for improvement even on that. The present administration seems to have started off with the right footing. The current Minister of Health and the Minister of State for Health and all the heads of the agencies have a good framework set out, which we're hoping that we'll see implemented very soon. They've been very consultative with members of the private sector and related stakeholders, and we hope to have them roll that out soon.
So you were talking about the opportunities for the private sector in the midst of this healthcare.
Yes, so there are many opportunities for the private sector. There are opportunities for the private sector at the primary healthcare level. There are opportunities for the private sector at the tertiary healthcare level. Working with the government, if we have a proper PPP framework, which is easy for people to plug and play and roll out, then we can have the private sector supporting the government, because healthcare infrastructure is quite expensive. And a lot of the infrastructure that we have was built back when the population in Nigeria was nowhere near the numbers we have now. So they're straining. So for the private sector to be actively engaged to invest in healthcare, there must be some incentives put in place.
What kind of incentive and what areas of investment? I mean, I know now, as somebody was saying, we've had some multinationals leave the country. Is this an opportunity for local production? Even though mostly we'll be importing the ingredients. So what are those areas where people can actually?
Yeah, so there's some low-hanging fruits, for want of a better phrase. Local manufacture of pharmaceutical consumables, drugs and all that, that can be done. Generics and all that. So if the government puts some steps in place, I know that discussions have begun with some private sector manufacturers to have that, because over 90% of our medication in Nigeria and other African countries is imported. Also, with the domestication of vaccine production, there are a lot of discussions in the works with private sector players across the country. I mean, recently I read in the papers, I think just yesterday, that in the last 10 years, we spent close to $40 billion on education and healthcare in Forex going out of this country. That's opportunity. That is the size of the opportunity that is available for the private sector to key into in Nigeria.
What incentive do you think could make this, make the private sector run to grab these opportunities?
So there are various incentives that could be put in place. Some of the obvious ones would be tax benefits. Some of the not so obvious ones would include some type of arrangement. As you said, the private sector is there for profit. So if a clear arrangement that can be made and all these can be signed off and they're valid, then we can get the private sector interested in investing in the healthcare, particularly at the primary care level and at the tertiary care level. I see at those two ends a lot of opportunities.
Good enough. You said that the current administration is having a lot of handshake with the private sector. So we hope these ideas will spill,
Yes.
rub off, and then we'll see it in paper and signed, as you said. All right. Thank you so much for your time, Dr. Tinuola Akimbolagbe, the Managing Director, Chief Executive Officer of Private Sector Health Alliance of Nigeria.
Thank you for having me.